If hand washing is the first line of defense against infectious diseases, then it is critical to infection prevention and control. And if COVID has taught us any lessons, it is that hand washing is key to pandemic preparedness. We must collaborate to change some of the existing realities as it relates to wash access in our country. Among these are the fact that 167 million Nigerians lack access to hand washing facilities with soap, that only about 55% of healthcare facilities have basic water supply services, and 17% of hospitals do not have any water services at all, that only 1 in 3 healthcare facilities have hand washing stations with soap at points of care, that only 1 in 4 have hand hygiene stations with soap and water in toilets, and only 1 in 10 healthcare facilities have basic sanitation services, and that 1 in 4 healthcare facilities do not have toilets or latrines on premises at all. Furthermore, only 15% of healthcare facilities have improved toilets which are separated for females and allow for menstrual hygiene management. 1 in 5 healthcare facilities have improved toilets which are accessible to those with limited mobility, and only 28% of health care facilities with wash facilities kept a dedicated budget for cleaning and maintaining these wash facilities. The absence or lack of adequate wash services in healthcare facilities can compromise patient safety. It can exacerbate infection spread, increase risks of hospital-acquired infections affecting staff, caregivers, and vulnerable patients, higher healthcare costs for patients, as well as undermine efforts to improve child and maternal health. It therefore means that policies and frameworks must be backed by action for change to occur. These are some of the changes that this campaign hopes to achieve to ensure that we'll build back better and can face future pandemics with greater courage. That never again will Ebola, COVID-19, or cholera kill our people, or trachoma cause our children to go blind. Scientists predict that with climate change upon us, the next pandemic is not a matter of if, but when.
With effective wash in our schools, in our health facilities, in our community, in our environment, we will do away with most of the diseases. And from Ebola and COVID-19 experience, while we see people constantly washing their hand or sanitizing their hand, a lot of this will be ward off. But it's saddening to note that since the diseases are going down, particularly after the Ebola experience and the COVID-19, the fact that the mortality rate is very low, a lot of us in the country did not pay due attention to this wash activity. We do not wash our hands regularly. We do not sanitize our hands as it ought to be. We want to call on the commitment and dedication of all stakeholders on wash so that the country will be rid of these infectious diseases. I want to establish the fact that Federal Ministry of Health will continue to partner effectively with all MDAs, WaterAid, and all other NGOs that are working in this regard.
We are also part of the campaign against open defecation, and we are also building their capacities. Reorientation of the behaviors, human behaviors on this regard, to make sure that they are discouraged from doing that. And I think recently, I think there are meaningful progress being made from the report NTGS gave us last time. Some states are, getting on there very well, but the campaign must continue so that people will. I still feel strongly that there must be an enforcement. There must be a penalty one pays for doing that. Because if it's not done, some people are naturally stubborn, and open defecation will continue. Sometimes and that thing too that maybe is due to lack of appropriate wash infrastructures and water. I believe if you have a very conducive wash materials and water, I think they will abide to the hygiene and sanitation practices. All stakeholders have to come in, both private sector and individuals that have a way to do do one or two things. In the health system, we also encourage our ward development. That in the primary healthcare sector, we encourage our ward development committees, because these ward development committees are made up of retired core civil servants or people of influential people that even their children can decide to say they give the whole community water. So we encourage people to buy the private sector to invest in that direction, and that's the only way we can do it. Like if we call it as a tax that must be done. I believe Nigerians are that challenge. You know what they can do. Like if you catalog the lessons as individuals, as groups we have learned, you see that by the time after using this mic now, I'll go and wash my hand. Yes, that. So that's part of the lessons we have learned. COVID-19 have taught us a lesson, and we can also participate in meetings through Zoom and all those things. Those are lessons. Things are going to get better.